Thank you, Shrestha. Thank you. I think I did not write the name of the live today, trauma. So maybe we have to edit it later on. I'll just wait for a couple of more minutes and then we shall start. Today's session is going to be a little bit more intense because the topic is trauma, and I missed out on writing that in the title. I can edit it right now. Yes, please do that. Please do that and just write the title of the live as trauma. So I'll just wait for a couple of more minutes, maybe 8:06 we shall start, and it's going to be a little bit intense, so I just want people to join and then we can start. Thank you. Thank you so much. So maybe 8:05 or in a minute's time we will start. So I can see two people are watching me live right now. One is Shrestha, the other one, I am not sure who is that. Hemant Kumar, okay. Okay. So trauma it is, and it's 8:05. A very warm welcome to the people who are watching me live right now, and those who will be watching this episode, the recorded episode. As I said that last month we had the entire month dedicated towards childhood disorder. This entire month is dedicated towards different segments of trauma. Now the reason why I chose this topic is in the last 1.5 month, whatever cases that came up to me, all were trauma, and I was very surprised that how come suddenly the trauma is all the way on the rise. But then while doing these sessions and everything, I understood that many people who understand depression or who considers depression as one of their disorders is actually suffering from trauma. So that's why this today's episode will be completely on the general idea of what is trauma, what exactly happens in our brain when we go through trauma, any kind of traumatic instances, what happens in our body, and how what are the general techniques with which we can come out. Other two lives that we have in this month will be specific types of trauma. Okay, so we will start today, and I will start with a very basic information that trauma comes from the Greek word which means wound. So as you can understand, the moment I say the word trauma, immediately it has a very painful, negative feeling that goes through your body. The reason is the sound or the syllables that were chosen when this word was created in English matches what is considered as wound in Europe, in the in Latin word. So it is important to understand that trauma is one such experience where the person becomes absolutely helpless. They don't have any coping skills. They don't know how to handle a traumatic experience. They have probably gone through various situations in their life, and that has probably made them, completely numb, and they just don't know. They feel extremely helpless, and it's not that the trauma patient will be in a traumatic episode throughout their life or throughout the day. It comes in sudden flashbacks, and that is one of the major difference between trauma and depression. While in depression, people do remember things, people do remember a lot of memories, but in case of trauma, you have severe flashbacks that comes back. So when you have flashbacks that comes, what happens is immediately everything at a in a flash of a second, everything you remember, and you do not only remember, you are actually living that experience again, and you feel the similar kind of pain, similar kind of discomfort in your brain, in your body, and that is what differentiates between a trauma and a depression. So for example, if I am depressed, whatever is the reason, I will feel sad. There is a general feeling of sad and despair. But in case of trauma, I'm fine. Like right now, I'm smiling, and immediately there is a flashback. Some trigger happens. There is a flashback, and I am in that, like 5 years back, 15 years back, 20 years back. I'm in that spot. I'm reliving the experience, and it feels horrible. It feels like you don't know what to do. You don't have any coping skills. You feel extremely distressed, and you just feel that somebody has tied up your hands and legs and have thrown you in the water, and you just don't know what to do. And it is very suffocating. The entire experience is extremely suffocating. You are crying, you don't know why you are crying, and it is like horrible. The experience is extremely horrible when it comes to trauma. Now, there is another major difference between trauma and depression. Another major difference is, in case of trauma, the experience is what we call somatic and psychological. Now, what is somatic? Somatic in usual terms is called physiological experience. So, whatever instances happen, for example, I'll take a very simple experience to start with: accident. So, you go through an accident, that memory is there in your brain. But in case of trauma, the memory is actually stored in every cell of your body. So basically, I have said this before in other lives too. So let's say when you go through an accident, there are jerks that happens in your body because the car is bumping against something or the other. But so let's say you have gone through that period, 5 years, 6 years have passed, and you think you have recovered from the accident, everything is fine. Now when you sit in the car and suddenly there is this jerk that happens, and if you have not recovered from trauma, immediately the entire memory comes back. Everything comes back in a flash of a second, and you're in that spot 5 years back, exactly what has happened. Your entire body becomes numb, you cannot move yourself, you go through anxiety, you go through panic attacks, everything at one point of time. That is trauma for you. Okay, so trauma, that's why a lot of when it comes to treating trauma, it is very different from that of depression. So people think you can do cognitive therapy, you can talk and you can bring people out of trauma. That does not happen, because there are a lot of memory that is there in the body that needs to get rid. You need to get rid of those memories too, along with the memories that are imprinted in your brain. Okay, so the body remembers that, not only remembers the traumatic experience, but it also remembers the kind of feelings, the kind of emotions you went through. It remembers everything. So even when the memory is over, the body still remembers that experience which was there. So for example, another example I'll give, another traumatic experience is rape victims. So let's say one person goes through the traumatic experience of being raped, and this person finally thinks that he or she has recovered from that experience. Now the body has gone through enough amount of torture during that entire instance. So you might have forgotten that instant. So no problem, Chandrani. Thank you for joining. So you might so Chandrani, you might just share it with one of your friends. I'm just not taking her name because this will actually help her understand her situation. We discussed this last time. So what I was saying is, let's say the rape victim. So this rape victim has gone through certain instances in their life. So few months have passed, few years have passed. The person thinks that, okay, I have forgotten about that instance. I am fine now. But the body remembers the torture. Now what happens is, next time there is no rape. But next time what happens, this person tries to get intimate with their partner. Let's say I just want to get intimate with my partner whom I love very well. And any act of the partner which is similar to anything that happened in the rape instance, immediately you put yourself into the flashback. You're in that flashback scenario. You remember everything that has happened at that point of time. You might just feel extremely suffocated, and that impacts your relationship too. So the impact of trauma is not only at that particular point of time. Trauma experience, people are experiencing in the cage of trauma since their childhood. There are many people, in fact, I have one such a person right now whom I'm dealing with, who is actually going through many issues right now but the root cause of the issue started when she was a child. So people don't understand. People think it's depression. People think I have attachment issues. I cannot form relationships. No, it just doesn't happen like that. It happens long back, and these are all traumatic experiences. Okay, so please feel free to ask questions, because I'm going to share the screen also. I'm going to show you what exactly happens in our brain when we go through trauma, right? So it is more intense than depression. It is accompanied by flashbacks, and trauma happens only when anything in your life happens too fast, too soon, too long. Okay, if anything has happened for a long period of time and you have been enduring it for a long time, you can go through trauma. If something happens too fast, you didn't expect it to happen, it's too fast, then also you can have trauma. But something happens too soon. There is a difference between fast and soon. Fast can be accident. Soon is you did not expect it to happen now, but it happened before it should have happened. Too soon, then also you can have traumatic experiences. And what example should I give? And another thing is too long. Definitely, yeah, the too long, people are suffering trauma in their relationships, at their family, in childhood onwards, etc. So childhood issues, accident, rape, uh, death, sense of loss, illness, injury, all these things leads to trauma. Any sense of loss, say losing your freedom, you think that you have lost your good number of years in your life, that you can't do anything about it. You think that every time you wanted to do something and it did not happen, and it happened for a long period of time, that also can be a trauma. You did not expect a relationship to end, but it just ended. That's like too fast or too soon or something like that. So you can have a mixture of too long, too fast, too soon, things like this, and you go through traumatic experiences. So it can take years for a patient of trauma to recover from trauma, or it can also happen very fast, within 6 to 7 months too, depending on what treatment the person has been put into. I want to reiterate in this particular live, many parents have approached me and told, oh, you can do a cognitive behavioral therapy and you can get my son or daughter out of this situation. First of all, it's my request, it's a humble request. Please don't throw terms at any person. You might have understood it from Google or somewhere that there is something called cognitive behavioral therapy, but one medicine does not work for every fever or every kind of illnesses. Trauma person, CBT, will work much later. Before that, the body with which they are constantly fighting, the memory that is stored in every cell of the body, that needs to be sorted. And along with that, many other things needs to be done. Many trauma patients, they will just peacefully sleep, and they will just sit like this, and they will constantly do like this, and they will constantly do like this, because as if they are hearing things, they are seeing things, and that's making it very difficult for them, right? I think I also faced a bit of issue while listening to others incident where they had to go through operation or any accident with lot of pains involved. I can feel my scars burning then suddenly. Exactly. So for you, the operation was traumatic because it happened, because this entire incident of operation and the treatment is happening for too long. So this is becoming more traumatic experience for you. So definitely it's going to happen. If any time I hear of somebody, anybody telling anyone that they are just leaving that person in between without any info, without any, like ghosting the person basically, I kind of relive the experience which happened in my life. So it is quite natural to happen. But thing is, for me, it happens and then I'm fine. But when a person is going through trauma, they are like stuck in the cycle, and then the constant loop is happening. That's the problem with the trauma patient, right? So there are many theories of trauma, but there is one very renowned theory which is called the polyvagal theory, and I'm going to show you exactly what happens in our brain right now. So I'm just going to shift my phone a little bit, please bear with me, and I'm going to share the screen with you, because visual experience is better than I continuously talking. I think you can see. Yeah. Can you see this? Can anyone confirm if you can see this diagram? Any one of you, can you confirm that you see this diagram or not? Yes, thank you, Shrestha. Okay, thank you, Chandrani. So, all right, I'll just hold it like this and now. So, hierarchy of the nervous system. What usually happens is when we are going through any kind of traumatic experiences or anything which is not normal, usually we get into a fight or flight situation. Either we want to run away from the situation or we want to fight that particular situation. But the moment there is some social engagement and social networking, so when we are in this situation and suddenly we go through social engagement, social networking, we talk to somebody, we are back to normal. So that's why you can see this is the red alert zone, and then once you have the social engagement, you are back to normal, right? Now let's say there is no social engagement, you don't get any support anywhere whatsoever, and you're constantly stuck in the loop of fight or flight, fight or flight, fight or flight. Suddenly there is a shutdown in the system. Now what is a shutdown? The shutdown is you just don't know how to react. You become numb. So if you ask these people, how do you feel? They will say, I don't know what to say. Because they are from here, they have been here for long. Now they have straight away gone here, the shutdown. They are no longer in the social engagement. So you can understand when people are saying that, how do you feel? And people are continuously saying that, I don't know how to put it in words. So basically they from fight or flight feel hopeless maybe. Hopeless, yes, but they are basically numb. They don't know what to say. It's like, anesthesia has been given to them. They don't know what to say. They can't express themselves anymore because they have been in this situation for such a long time and they have got no support here. And then they have chosen this as their defense mechanism. They have shut themselves off from everything. Now, if at that point of time, suddenly their parents or their well-wishers suddenly want them to bring here, it will never work. Trust me, it will never work. That is exactly where Indian society does a mistake. India feels that, the parents feel that, okay, the person has been in this particular period for such a long time. Let me help them to make friends and everything will be fine. No, the person has already shut themselves off from the social engagement too. So it will not work. So from here, the person will, again, if you're trying to bring them out of this, they will constantly go through fight or flight, fight or flight. And slowly and steadily, they will go back to social engagement. That's why you see there is no arrow between social engagement and shutdown. There is either here or here. So either way, either you can operate between these two or you can operate through this. Okay. Any questions so far? Like, I hope I have been able to make sense, because the next thing that I'm getting into is a little bit more intense. You're exactly going to see how your brain works when you go through traumatic experience. Any questions so far, anyone? Am I making sense? Yes, no, maybe. Either I'm being very boring sessions or something like that, or it is making sense. Clear so far? Okay, thank you, Chandrani. So next, I will show you exactly what the brain looks like. Okay, how is the normal brain looks like, what happens when you actually face the traumatic instance, and what happens when you are constantly facing the traumatic experience. Okay, so here comes the thing. Right, so I'm going to show in bits and pieces. All right, let's start with this section, the social engagement section, this green part. Okay, now this green part is basically the normal part, like how I am right now, how you are right now, maybe, just maybe, you might not be as well. So green part, as it suggests, social engagement. It is of connection, safety, oriented to the environment. It is the joy, it's in the present, you feel grounded, you are curious, you're open, you're compassionate, you're mindful. This is how we usually are. And this segment of the brain is called ventral vagal. So this is the entire brain. This entire segment is the brain. But right now I'm only talking about this green segment, which is the social engagement sector. That is what we usually are. This is called the parasympathetic nervous system. So the nervous system has primarily two segments. One is the sympathetic, one is the parasympathetic. But the parasympathetic can be of two categories. One is ventral vagal, one is dorsal vagal. Now I will tell you why it becomes where does the third category comes from. I will explain all of this. So don't get overwhelmed with such a diagram. It is very easy to understand. So as of now, the green is how we operate in usual way. So if we are in the social engagement in the green sector, you will feel that you are hungry, you feel like going out, you have resistance to infection, that means you have immunity, you can take rest, you can recuperate, then your organs are working fine, your health is fine, you're able to relate and connect. Okay, and you're not defensive anymore. So this is the level of our brain. Now something happens, just something happens in the life, a breakup, accident, an accident, or any traumatic loss, anything happens in their life. The person starts to operate in the sympathetic nervous system, which is the red segment. The sympathetic nervous system, what happens is, here the person is operating with the fight or flight, as you can see here. Fight or flight, moving away or moving towards. So if you are flight, then you are moving away from the situation because you are worrying, you are panicking, you have anxiety, you have fear, etc. Or you want to fight the situation, so you are angry, you are frustrated, you are irritated, you have extreme rage towards others. Okay, so here you still are in the I can mode. Even if you are in the sympathetic range, you are still in the I can mode. You can see here the I can. You still can work. So even the fight or flight, if there is social engagement, if there are people who are trying to help you, if you have support system, you can come back to the social engagement. So this thing, you can come back. It's like sea waves. It goes up, and through proper support at the right time, it can come down. So it can happen like that, fight or flight or social engagement. Now let's say you have been in the sympathetic segment of the brain for a long period of time. Long period. Let's say no, you did not get any support for a long period of time, or you didn't even understand that you needed support or anything like that. At that point of time, this wall of the sympathetic range is broken. The entire sympathetic range, this range is deactivated now. So you are either numb or you are completely frozen. This part is again the parasympathetic range, but this is dorsal vagal. Dorsal vagal is associated with freezing. You become numb. You don't know what to do. You don't know what to say. It is disassociation, numbness, depression, conservation of energy, helplessness, shame, shutdown, hopelessness, preparation for death. So people who are planning for suicide or killing themselves, they are working from the dorsal vagal part of their brain. They feel trapped. They will keep on saying, I feel trapped. It's a loop. I can't do anything. Right? So what happens in this situation? What happens with your body? Your heart rate, your blood pressure, temperature, muscle tone, facial expression, everything decreases. Even your sexual responses, your immune response, everything decreases. Many people who are suffering from depression have been COVID infected. There's a reason why, because their immunity system has been infected for long, because they have been in this one for long. So I hope I'm making certain sense here. So social engagement is this part of the brain which is usually the normal range in which we operate. When something happens, we go into this segment, which is fight or flight. If we can come down, then this is the cycle in which any normal human being would operate. Somebody who is going through trauma, they will break this line, and they will straight away move here, and they go through a freezing point, numb. And they have their health, not only mentally, physically also they are broken at that point of time. Many issues will come up, dermatological issues, absolute sense, and it is somewhat scary. Yes, it is scary. It is scary, and you know, as you can see that, you know, just listening to it is so scary. How would a trauma person would feel day in, day out, years, to be in that state of freeze, state of numb, being numb, nothing. They don't feel anything, they don't know anything. The only thing they feel is the flashbacks of anything happens. And you can see immunity system will go down, dermatological issues, eye problem, you will fall suddenly you're hurt. A lot of things will keep on happening with you because your immunity system is grown somewhere. Okay, so this is how the brain is. The sympathetic, the parasympathetic, where we normally are, then comes the fight or flight sympathetic, and then comes the freeze. So a trauma patient is on the freeze segment. Now the thing is, when they are continuously in the perpetual fight flight, they are continuously either numb or anxious or depressed, or they don't know what to do because they have been in that situation for such a long time. Any normal feelings, any normal emotions for them is abnormal. So let's say I am a trauma patient and you are absolutely normal. You are smiling, you're laughing. I would feel, why she's smiling? Because I forgot how to smile. Why would I smile? Things start getting difficult for a trauma patient. Not all trauma patients will show the same kind of symptoms, but majorly these are the symptoms of a trauma patient. Okay. So that's why often when the person is in the freeze zone, you know what is the first thing we ask them to do? Move. Just shake yourself. Just continuously shake yourself so that your body, you know, you are sending signals to your brain that your body can come down from the freeze section to the fight or flight, and from there to the normal range. That's why we ask them to shake. It's like if somebody is deep asleep, we shake them. Utho, utho, utho. So it is almost like you're telling the trauma patient, utho, utho, utho. It's like that. So yes, there is a lot of work that needs to be done with the body, but that's not the only area. There are many things that needs to be done when it comes to trauma. Okay, so I'm going to share a small case study that I had written over there. So Peter Levine, a longtime friend and colleague of the person who designed this entire trauma theory which we discussed so far, had studied that the shutdown response through animal observations and body work with clients. In Waking, there is a book called In Waking the Tiger. If any one of you is a book lover, you can read book Waking the Tiger. That is a book on trauma. So they have seen that a sudden shudder is required for the person to either wake up from the fight or flight or the freeze zone. Sudden shudder. Sometimes we often tell the person, you lie down on the floor and just shake yourself. It's like this, just like shake yourself. So you are just telling your brain, wake up, wake up, wake up, wake up. It's like sending electric signals to your brain, you know. So that's how it works. This is more or less the understanding of trauma. Now comes at what are the different types of trauma, So first is the acute trauma. Acute trauma results from a single incident, not multiple. One instance that has led to acute trauma. The next is chronic trauma. Chronic trauma is repeated and prolonged trauma such as domestic violence or abuse. Prolonged, too long. Okay. The third one is the most difficult to solve, which is called the complex trauma. Complex trauma is not one instance. There can be multiple instances that has added to the person's trauma. So if you want to solve one part, suddenly something else works as the trigger. If you want to solve, like, you know, you touch this part pains. You touch that part, the other part pains. So complex trauma is an invasive interpersonal nature. So one thing is related to the other, and it has led to a very complex situation for that person. So these are the types of trauma. Now what are the symptoms of trauma which I have noted down? Of course, shock, denial, disbelief, confusion, difficulty in concentration, anger, mood swings, anxiety, panic attacks, guilt, shame, withdrawing from others, disconnecting yourself from everything around you, digestive issues, fatigue, dermatological issues, any physical issues, constant headache, feeling extremely jumpy, feeling disconnected or numb, suicide ideation, flashbacks, no communication or prolonged wailing, constantly crying, we don't know why. Okay. Now, what are the solution for trauma? Of course, there is solution, but trauma takes time to get solved. So, if the client is constantly, or if the person is in a shutdown mode, the first thing is to shake the person, putting the person through some social engagement in, using a medicine dropper, not put the person suddenly in a group and you feel everything will be fine. No, one person or the other, one by one, building the trust of the person. That is one step. Shaking, a little bit of dance movement therapy will be very beneficial for traumatic patients. But apart from that, there are others too. Music therapy. Music therapy works excellent for traumatic patient to calm down, because it's brain. You have to calm it down so that it can actually start working at the normal range. Next is EMDR, or eye movement desensitization. That is, whatever memory you have for the trauma, we try to distort that memory. So basically, memory is anything how you want to remember it. You want to remember it in a bad way, that is how you will remember it. If you want to remember it in a good way, that is how you would remember it. So EMDR is a technique we do to distort the memory of the mind. How, that I am not going to share. EFT, emotional freedom technique, is like tapping the person. There are 10 energy meridians of our body. So all the energy, all the memories are stored in 10 parts of the body. So when we keep on tapping such points, there are 10 parts. Maybe I can do another live on the EFT part. So when you keep on doing that, these are basically knocking, ghar mein koi hai, that kind of a knocking, and things will start flowing out. There is something called timeline therapy. Timeline therapy is basically taking you back in a systematic manner, taking you back to the traumatic experience and releasing it, but in a systematic manner, not just randomly. Then the person will be in eventual freeze moment. Hypnotherapy, Reiki, yoga, meditation, cognitive behavior therapy, support network, and if nothing works, then only medication. But in all probability, medication is not required for a trauma patient. You can actually handle them with all these things. And you have seen CBT came much later. So, but in problem here is everything starts other way around. It starts from medication, support network, CBT, yoga, meditation, and that's why it never works. So it has to start from, the funnel has to be different, and the people are using the funnel in the different position. So that is pretty much about trauma, and I really wanted to talk about this because most of my patients nowadays are going through trauma. 20, as I said, 20 to 35 is the major age group that they are going through trauma. So the next live that we have is on post-traumatic stress disorder. That we will have next week. So today's live is at the general understanding of what is trauma and how our brain reacts and everything. I hope this is useful for you, and if you find it is worth it, then please feel free to share it. Not for us, not for Virupana. When you share it, somebody else might see and they might just know what they are going through. So please share this thing. Let people be more aware of what is happening inside their mind and in their body. Let's not call everything in the world depression. There are far more serious things than depression. Okay, so thank you everyone for joining the live, and hopefully I've been able to add certain value today, and we'll see you next week with post-traumatic stress disorder on our Instagram page of Virupana. Till then, please feel free to share this live and just be more aware and informed. Trust me, everything can be solved, and trauma can be solved without medication if you are treated at the right point of time. Thank you very much.